vision. Improving life today. Inspiring progress tomorrow.
Located in Atlanta, Midtown Urology and the Midtown Urology Surgical Center are committed to providing its patients with excellent urologic care, offering diagnostic services, medical treatment, and innovative surgical procedures. Doctors James Bennett, Janelle Foote, and Paul Alphonse define their practice's success by not only the quality of their work, but the overall relationships forged with their patients.
But Midtown Urology started in the mid-'80s, and at that time I was a solo practitioner, so I was a jack of all trades. But since that time, with the recruitment of Dr. Janelle Foote and Dr. Paul Alphonse, we've broken off into specialties, and my specialty and my keen interest is that of prostate cancer. And that's where I've really devoted most of my efforts and education most recently toward addressing this disease.
Here at Midtown Urology, we see a variety of patients who have problems with their bladders, problems keeping the urine in and problems getting the urine out. We employ a variety of treatment regimens to enable good bladder control and good bladder habits. Education is very important for us. We educate our patients with a variety of means. These include the use of printed media as well as CDs and tapes. Patients receive verbal instructions and explanation while they're here in the office from myself, my PA, my nurses, my other staff. I look at the work that I do here as being able to help a patient get control of this problem, which as a medical problem sometimes morphs into a social problem and an emotional problem. By getting control of this, my patients are better able to enjoy life and to attack other things that are important for them.
We strive to provide excellent care in terms of erectile dysfunction and infertility. For instance, in erectile dysfunction, we provide the full gamut in terms of PO or pill medications, injectable medications, urethral suppositories, and inflatable penile prostheses. In our infertility patients, we provide them not only necessary the appropriate information that they need from me, the physician, but I provide them with actually handheld materials that explains to them how a semen analysis is provided, explains to them how a semen analysis is interpreted.
When Walter got the news, he feared he would become just another statistic, a man stricken with and ultimately succumbing to prostate cancer.
I was very disturbed. I felt like that I was facing a critical time in my life. Obviously, the next thing that crossed my mind was I wanted to get the best procedure, the best scientific approach to the solution.
Walter is not alone. According to the American Cancer Society, prostate cancer is the most common internal cancer found in American men, as well as the second leading cause of cancer death. In fact, nearly 219,000 new cases of prostate cancer will be diagnosed in the United States in 2007.
That's what drives them into the office, the fear of having this quote-unquote deadly disease. So once we get them into the practice and into the system, we teach them the importance of watching what they eat. We teach them the importance of knowing your family history, because all of these factors probably play a part, a very important part and role in not only in the diagnosis of this disease, but also ultimately in the treatment of the disease.
Walter turned to Dr. James Bennett at the Midtown Urology and Surgical Center in Atlanta for treatment. Dr. Bennett specializes in the education and innovative treatment of prostate cancer.
In Walter's case, we use a procedure that's called cryosurgery of the prostate, which is using ice to kill prostate cancer cells. The way the procedure is done, we place probes inside of the prostate, which forms ice, and then we activate these probes and we monitor the growth of the ice using ultrasounds, which prevents damage to organs such as the rectum that we do not want to freeze into. Cryosurgery does require some specialized training. I spent years learning the procedure and using a variety of different types of equipment, which has improved my ability to perform this procedure as well as perform it very safely. At this time, I've probably done close to 700-800 of these procedures with very minimal side effects. One of the other procedures that I do use to treat prostate cancer is different forms of radiation therapy, but particularly a procedure that's called brachytherapy or prostate seed implants. And what that entails is placing radioactive particles within the prostate, which kills prostate cancer and prostate tissue over a course of time. And at the end of this treatment, most patients achieve a PSA value, which is the blood test that monitors prostate cancer, very close to that of a radical prostatectomy. The pain that's associated with these minimally invasive procedures is far less than that associated with a radical prostatectomy.
Now, after caring treatment and support, Walter's health is back on track, and the fear of becoming a statistic is giving way to a renewed vigor for life.
I was treated by Dr. Bennett in early 2002. He gave me all the options available and all the procedure options that I could consider. And I elected to go with cryosurgery because I felt like it would provide me with what I needed and probably the most scientific and up-to-date method. I recovered very rapidly. I was back on the job within about 6 days, maybe 7 days. I feel as good or better than I did before I ever had it. I did get state-of-the-art service and technology administered to me by Dr. Bennett.
Contact Midtown Urology today. Educating and creating awareness in men is the best defense available in the war against prostate cancer.
When you hear patients change in their life based upon what you and your practice have done, really touches your heart. And that is the basis of why I think that Midtown Urology is regarded in the standard that it is regarded, because of that connection and that outreach and that giving back.
We feel that clinical research enhances our clinical practice at Midtown Urology. Patients who see us in the practice are candidates for inclusion to a variety of clinical trials. These include clinical trials that address things like prostate cancer, as well as bladder control problems and sexual dysfunction in men and women.
What I love to offer here at Midtown Urology to our patients is our minimally invasive treatments, curtailing again to what I specialize in terms of infertility and erectile dysfunction. Varicoceles are quite common in infertility patients, and instead of using the old-fashioned incisional hernia type repairs, I do a laparoscopic varicocele repair that allows the patients to go home the very same day and essentially can be back at it in approximately 24 to 48 hours.
I was diagnosed with prostate cancer in 2002. And at that time, Dr. Bennett indicated that there were a number of procedures that could address the level of prostate cancer that I had. And I chose the seed implant because it was the least invasive. It has the fewest chance of adverse side effects. And I'm really glad I did, because since having the implant, I could hardly name a symptom that I've had that has been painful or even uncomfortable. Here it is 5 years later, and my symptoms have been minimal. My PSA level has gone from a 6.6 to a 0.22, which was 3 months ago. And I owe a lot of that to the expertise that Dr. Bennett brought to bear on this matter. He knew what he was doing, he knew how to do it, he's done it a million times, and I've gotten excellent results as a consequence of being treated by Dr. James K. Bennett.
Here, we don't prepare people to die. I prepare people to live, and regardless of whether that life entails a month or 6 months or 20 years, I don't know. But my job is to prepare people to live, and that's what keeps me going, is that when I see that I've influenced a patient and I've influenced that patient's life, that is the energy that continues to make me want to do the kinds of things that we have done for 20 years here at Midtown Urology.